What distinguishes us here at this medical center is that we have the full capacity, capability, and commitment to deliver the full spectrum of cardiovascular care to our patients. And we have a great team, not only with great clinical experts, but also with other team members that are able to help the patients access the care and be part of their care so that they can get the best long-term outcomes.
In the Healthy Heart program, there are a lot of team members, so it's a multidisciplinary team approach provided to the patient, and we have a lot of diagnostic modalities.
We have advanced technology in cardiovascular imaging that allows us to really identify the best test for the patient to identify the underlying disease and then the best treatment for that patient. With the cardiac CT, we're getting gated information or information of the heart moving throughout the cardiac cycle, and we're able to calculate function as well as take a snapshot image of coronaries or to look at the overall function of the heart. Within MRI, we're looking at myocardial function as well as looking at myocardial disease, which gives us a lot more information of the heart and the myocardium, as well as how the chambers are working together and the actual tissue itself.
Electrophysiology is a subspecialty off of cardiology that deals with the rhythm of the heart. There's different ways we can treat abnormal heart rhythms. One part of electrophysiology deals with studying the electrical activity within the heart through ablations. With the new innovations in these new mapping systems, we're able to get more accurate, more detailed, and a lot more data in a shorter amount of time, thus decreasing the amount of time the patient is on the table and increasing our success in ablating the abnormal rhythm.
We have the latest technology in echocardiography. For the technology gives us that ability to see specialized specific structures within the heart that enables us to diagnose advanced disease. So this technology enables us to help and treat and diagnose patients with heart failure. We're able to diagnose severe forms of valvular heart disease, and it enables us to better assess when and at what point that valve would need to have a procedure done to fix the underlying problem.
Other areas where we are, in fact, quite innovative is in arenas of clinical research. Patients volunteer altruistically, knowing that they may get some benefit, and if it's not for their benefit, it will be for the next patient. One of the most important studies that we're involved with is infusing a gene directly into the heart that actually allows the heart to produce a new muscle protein that hopefully will help the heart contract better and help the heart recover function. This is really at the cutting edge of modern medicine in the treatment of patients with advanced heart failure. We are the largest training institution in the state of New Jersey. That interaction creates an opportunity for ongoing learning for all of us, which is profoundly important in medicine, which is always a rapidly changing field. You know, it's one thing to have the great technology, to have the great capacity to diagnose and treat, to bring new innovative therapies to patients, but how do we ensure that they get the care? The Healthy Heart program that we have developed over the past several years is to really focus our attention on how we deliver the care to the patients in our community.
So any patient who has any diagnosis of heart failure, besides having any other condition or medical condition, they are the people who are enrolled in that program.
I wasn't getting the proper care where I was going. Because of the classes, I'm active. I'm not afraid to do things because I had heart surgery. I come from another city to come to this hospital.
I couldn't breathe and I couldn't walk. I started going there lifting weights and walking. All that built me back up. Now I do it at home. It just changes you, to some point where you don't feel as sick. You feel that there's a chance, there's a hope. That's what I get from my doctors, especially Dr. Solanki. I trust her with my heart.
We have clinicians and doctors in cardiology who are really extraordinary, not only in their knowledge, but extraordinary in their commitment to delivering excellent patient care to this patient population that is here in Newark, that is somewhat underserved. There's a program that we're in the midst of developing right now, which is called our Community Healthcare Worker Program.
We want to reach out into the community and really go to a patient's home and help educate the patients so the community healthcare workers can expand that knowledge to the other members of the community and can in turn really help in improving a population health in general.
Of course, resources are extraordinarily important. The support for new technology and for a community healthcare worker program would be very, very helpful. My hopes for our patients is that we can improve their quality of life so that they can live more complete and fuller lives. That's our goal every day, every time, every patient.